Hey, I'm Sydney. I'm going to be your labor and delivery nurse. Congratulations. Okay, I'm just going through my admission checklist here. I do still need to draw some blood work and insert an IV. Oh, I'm really not a fan of needles, and I'm gonna want to do this like all natural. Like, I don't want any interventions at all, so I really don't want an IV. I just think it's gonna impede my ability to move around, and I don't want anything harmful being put into my body. Oh, I'm so sorry. I should have been more clear. We don't actually use an IV. It's a saline lock, so it's just a little access point into your bloodstream, and we only use it in emergency situations when we actually need to. So for example, if you start to bleed really heavily after you've delivered your baby, I don't need to hook it up to anything, so no fluids, anything, only use it if I absolutely have to. Another reason why I really like to have IV access is because if you decide at some point that you actually do want an epidural, we don't need to actually insert an IV at the time. We already have it in place, and we do need IV access for epidurals because we need to be able to give you fluids to help prevent your blood pressure from dropping. I don't know, it still kind of just freaks me out, the idea of a needle being like in my arm the whole time. I don't like that. So IVs actually only have a needle that we use to insert it. Once we've inserted it, we take the needle out, and it's just a thin plastic tube that stays in your vein. It can be a little bit irritating the first hour or two when you have the IV, but eventually you won't even notice that it's there. Oh, really? I had no idea. I thought there always was like a needle that stayed in there. Okay, you know what? After hearing the benefits, I think that it's probably the right idea. But if we can avoid putting it in a spot where I'm going to be bending my wrist or arm, that would be ideal. I do have to draw blood work with all of my patients. We like to do a CBC just to have a baseline of what your hemoglobin, your red blood cell count, your white blood cell count, all of that was before you actually delivered. This way we can measure how much blood you've actually lost if you do happen to have a postpartum hemorrhage. And then we also like to type and screen your blood, meaning that we'll have your type of blood on file in case we do need to give you life-saving blood in an emergency. So I can actually do this all within the same poke, and we can definitely do it in a spot that's a little bit less uncomfortable and not in a joint, so that way you can move freely throughout your labor. And don't worry, it's not going to impede your ability to go in the water. We can just cover it up if you want to go in the bath or the shower throughout your labor. Thank you so much for keeping me so well informed and for making sure that me and my baby are safe. I'm here to support you and your baby throughout this process, but also to make sure that you guys are well informed and that you both stay nice and safe and healthy. That is my number one goal. But of course, I'm here to also listen to anything you have to say, and don't hesitate to ask any questions you have throughout this whole process. I'm here to answer them.